welcome to our webinar this morning, hosted by the National Center on Substance Abuse and Child Welfare. It's our webinar and dialogue series, implementing a family-centered approach for families affected by substance use disorders and involved in child welfare services. As I said, today's dialogue is presented by the National Center on Substance Abuse and Child Welfare, and we want to thank you and glad you can make it. This presentation was developed by the National Center on Substance Abuse and Child Welfare, which is an initiative of the Department of Health and Human Services. We're jointly funded by the Substance Abuse and Mental Health Services Administration Center for Substance Abuse Treatment and the Administration on Children, Youth and Families Children's Bureau's Office on Child Abuse and Neglect. And we thank all of them for this opportunity today. And I'm excited today to introduce our presenters, Kimberly Coe, Deputy Program Director for the Regional Partnership Grant Programs at the National Center on Substance Abuse and Child Welfare, and Lisa McElroy, Program Associate, also for the National Center. Kim and Lisa will share with you today an overview of our new family-centered approach modules. Over the last about year, staff at the National Center have worked to put together this resource to assist with the implementation and expansion of family-centered services. So we're excited to share this overview with you today. And with that, I'm going to pass it off to Lisa. Thanks, everyone.
Thank you so much. Yes, we're so excited to share this new resource on this very important topic with you all today. During today's webinar, we'll provide an overview of each module, including Module 1, Overview of a Family-Centered Approach and its Effectiveness, Module 2, On the Ground, Family-Centered Practice, and Module 3, Collaboration to Support Family-Centered Practices at the County and State Level. And if time permits, we'll answer questions and review some resources that might be helpful in your work. Our contact information will also be posted at the end of the presentation if you'd like to connect with us for more information or request technical assistance and support. To help communities move toward family-centered care, the National Center on Substance Abuse and Child Welfare developed a series of companion modules on implementing a family-centered approach. This series is designed for state, county, and agency-level collaborative partners that are working together to improve systems, services, and outcomes for children and families affected by substance use disorders. So Module 1 provides an overview of a family-centered treatment approach and some of the research that demonstrates its effectiveness. Module 1 highlights the essential ingredients resulting in positive outcomes for families and also provides a series of steps that communities can take to implement this approach. And now I'll turn it over to Kim, who will present a closer look into Module 1.
Thank you, Lisa. We'd like to begin our discussion today by talking about what family means. How systems, programs, and agencies define family has wide variation. Families are diverse and can be made up of biological family members, extended family members, non-biological relatives, or friends that become family. Families come together in all kinds of unique ways. And what makes someone a family can't be defined by DNA or even legal status. Family is about the unique bond, loyalty, love, and support that exists between people and ultimately creates a sense of belonging. A sense of belonging is a basic and necessary human need. We also know that cultural identity affects family membership and makeup. Different cultures and belief systems influence definitions of family, and because cultures and beliefs change over time, definitions of family are by no means static. A family-centered approach recognizes and accepts the individual person's definition of family. A critical first step in implementing or expanding on a family-centered approach is establishing a clear definition of family and articulating that not only for the families that you serve, but also for your collaborative partners. A family-centered approach extends well beyond the substance use disorder treatment system, the child welfare system, the courts, and mental health services. It includes all other agencies and individuals that interact with and serve families. It was important for us to be very intentional about our language. We use the phrase family-centered treatment when we're talking about treatment specifically, but whenever possible, we used family-centered approach to be more encompassing of all systems. For sure, not all this work is clinical. A family-centered approach is important with schools, doctors, early education providers, really anyone that's providing services to people. The work of all community partners must reflect an understanding and a responsiveness to the fact that parents and children live within the context of a larger family system, and that families exist within the context of their community and culture. The cultural influences of race, ethnicity, religion, geography, and customs are considerations that must be prioritized when implementing a family-centered approach. When systems and individuals working with families affected by substance use disorder recognize that substance use disorder is in fact a brain disease rather than a personal failing or chosen behavior, it can help to reduce stigma. And unfortunately, despite all the public education about substance use disorders, stigma remains a significant barrier to people getting the treatment they need and for systems to build effective collaborations. Efforts to reduce stigma by recognizing addiction as a brain disease helps to ensure that individuals are seen as people needing and deserving recovery. A family-centered approach is often a paradigm shift from business as usual. Identifying the family as a system requires a shift in thinking for service providers who have traditionally focused on their identified client. What we know is that child safety and parental recovery are critically linked to one another and must be addressed holistically to ensure the best outcomes for families. There's not currently a universally accepted definition of a family-centered approach or a specific model. As a result, each treatment agency or service provider may operationalize a family-centered approach differently. Differences in practice may reflect regional variations, the needs of different populations, or the availability of services in that region. We've created this graphic to represent components of a family-centered approach. Despite differences in definition, there are a set of common essential ingredients to a family-centered approach that are used across the continuum of providers. Those ingredients are collaborative partnerships that you see represented as the roots of the tree, adequate and flexible funding, performance monitoring, intensive and coordinated case management, and high-quality substance use disorder treatment, all represented in the trunk of the tree. And finally, a comprehensive array of services represented in the many limbs of the tree. We're going to talk more about these essential ingredients later in the presentation. As we mentioned earlier, parents and children live within the context of a larger family system, and families exist within the context of their community and culture. In order to meet the complex needs of each family member, it will require collaborative partnerships and a comprehensive continuum of care. An array of services is necessary to be able to respond to the needs of all family members. Some examples of family-centered support services seen in a comprehensive service array include family strengthening services and programs, evidence-based parent-child programs and parenting programs, culturally responsive and gender-specific programs, individual and family therapy to address mental health and trauma, children's services to address identified developmental issues, healthcare, trauma, and mental health, early childhood education services, recovery support services such as peer mentors and recovery specialists, and linkages to family health clinics. Wraparound support and services such as childcare, vocational support, education, housing, legal aid, and transportation are all parts of a service array commonly found in a family-centered program. I'd like to talk about a couple key pieces of legislation that underscore the importance of a family-centered approach to effectively treat substance use disorder and promote sustained recovery and family well-being. The first is the Comprehensive Addiction and Recovery Act, referred to as CARA. In 2016, CARA legislation identified key changes to the Child Abuse and Prevention Act, commonly referred to as CAPTA. The amendment clarified that the population being addressed is infants born with and affected by substance use, withdrawal symptoms, or fetal alcohol spectrum disorder, specifically removing the word illegal from the definition. CARA legislation is about ensuring these children receive the services they need to grow and thrive. We know that prenatal exposure to any substance may result in negative effects for the infant. Some of the most damaging substances for an unborn child are nicotine and alcohol, neither of which are illegal. This change in legislation was an important step for all families. The other important distinction in this legislation is that CARA requires that the plan of safe care that's to be developed for infants that meet the definition of prenatal exposure need to include the needs of not only the infant, but also their family members or caregivers. These changes emphasize the understanding that in order to truly serve infants with prenatal substance exposure, we must serve their whole family. The next piece of legislation that I'd like to reference is the Family First Prevention Services Act. Family First is part of a broader vision for changing national child welfare practice. And while we don't have time today to get into all the details of the legislation, there are three key takeaways that I'd like to share with you. Family First legislation focuses on strengthening families and communities. It recognizes the importance of working with children and families to prevent unnecessary foster care placements, and it focuses on prevention of child maltreatment as the primary goal, rather than foster care placement as our main intervention. Family First provides an opportunity for states to envision, advance, and vastly improve their way of serving children and families. This next graphic shows a continuum of family-centered treatment on which substance use disorder treatment programs can exist. The process of integrating a family-centered approach into traditional substance use disorder treatment takes time. And as a result, substance use disorder treatment providers can be at different points along this continuum. Family-centered treatment addresses the effects of substance use disorders on every member of the family. This treatment approach focuses on the needs and welfare of children within the context of their families and communities. And family-centered practice recognizes the strengths of family relationships and builds on these strengths to achieve optimal outcomes. You'll see that the left-hand side of this continuum recognizes that at a minimum, family-based services acknowledge the influence and the importance of family, provide for family involvement, and address family issues in individual treatment plans. The most comprehensive model of family-based treatment is a model in which each family member has an individual treatment plan and receives individual and family services as represented on the right-hand side of this continuum. Family-centered treatment emerged from substance use disorder treatment models focused on the individual, and programs have increasingly integrated the needs of family members over time. Most programs exist somewhere along this continuum, but there are too few that meet the standards for fully family-centered as defined by the right-hand side of the chart. While we want programs and services to keep moving toward being fully family-centered, we know that it's complicated by funding, policies, staffing, and many other roadblocks. It's important to note that this isn't an all or nothing model of care. Every step we take toward a fully family-centered approach is a step in the right direction for families. Earlier, we talked about the essential ingredients of a family-centered approach in the picture of a tree. When implementing a family-centered approach, we can look at each of these ingredients and how they fit into the structure of existing services. A governance structure assures ongoing buy-in by policymakers, management, community partners, and operational staff. A formal collaborative governance structure is used to prioritize, oversee, and sustain the partnership. Collaborative partnerships, adequate and flexible funding, and performance monitoring are activities and practices that align with the governance structures of organizations. Intensive and coordinated case management, high-quality treatment services, and a comprehensive service array are the clinical practices that align with the family-centered approach. Collaborative partnerships are the foundation of a family-centered approach. And you see that represented in the tree, the roots of the tree. A single provider is unlikely to be able to provide all the services a family needs due to the costs, staffing, clinical expertise, and sometimes even the physical space required to provide those services. Service providers can establish collaborative partnerships with community service providers, county and state administrators, and funders that can support the development of a comprehensive, community-based, family-centered approach. Some of the characteristics of effective governance and collaborative partnerships include establishing a shared vision and common goals, developing a shared understanding of and respect for each partner's role in serving families, which requires putting aside assumptions and preconceived notions, ensuring open, transparent, and frequent communication across systems and at all levels of the organization, establishing a process for data sharing, including formal data sharing agreements, and defining practices to address barriers and disagreements when they arise. Sometimes this step is overlooked at the beginning of the partnership when the notion of disagreements is not anticipated. Cross-systems trainings that increase capacity building and staff development are also an important element. Ideally, these partnerships become an established collaborative or initiative that will continue to address barriers, support interagency partnerships, and promote information sharing to benefit all families. Implementation of innovative services requires new and flexible funding. And we hear time and time again that funding is often seen as the most predominant barrier in implementing and sustaining a family-centered approach. We'll talk more about that in just a few minutes. A critical part of any governance structure involves performance monitoring. Effective programs develop a process for regular performance monitoring and ongoing quality improvement. As treatment and service providers and their collaborative partners work together to implement and sustain comprehensive family-centered treatment, it's important for them to identify shared performance measures that are mutually beneficial and build data dashboards to monitor progress in family outcomes. Clinical practices that are key ingredients of the family-centered approach include intensive and coordinated case management for families. Intensive and coordinated case management ensures that treatment providers and collaborative partners are coordinating their services, addressing barriers to access and engagement in services, and sharing information on families' progress against baseline data. Coordinated case management also includes information sharing protocols. This level of case management enables service providers to establish the creation of a sustained, integrated, non-duplicative, comprehensive assessment, referral, and service path for adults and children through multidisciplinary collaboration. This also eases the burden on families interfacing with multiple service providers at one time. Some community collaborations have actually incorporated using apps to coordinate case management and help families navigate through service systems. At the heart of a family-centered approach is a high-quality substance use disorder treatment program that uses evidence-based and trauma-informed models to deliver therapeutic services and continuing care support. Families require access to these services that address the needs of children and adults and that support and strengthen the family across the continuum of services. Earlier, I shared some examples of a comprehensive service array. And as I stated earlier, services may look different depending on the target population and geographic location. Before any case planning begins, a comprehensive assessment of strengths and needs for each family member is necessary. Family-centered treatment programs identify which services are required to meet the needs of its clients based on a structured assessment, and then work to establish an array of services specific to that family's needs. This slide highlights some select positive outcomes of a family-centered treatment approach. These are just a few examples of many positive outcomes that we know exist across the country. There's a growing body of research that demonstrates the effectiveness of family-centered treatment in improving child, parent, and family outcomes. Some of the other family outcomes that have been demonstrated include increased treatment retention rates and reduced substance use rates, decreased child abuse, increased rates of reunification and positive permanency outcomes, reduced rates of infants with prenatal substance exposure, improved psychosocial and family functioning for children, parents, and family members, improved parental mental health, physical health and employment, reductions in depression and parental stress, improved parenting attitudes, enhanced parental bonding with children, and improved child development and behavioral outcomes.
Thanks, Kim. Module 1 provided an overview of the importance and effectiveness of a family-centered treatment approach and introduced the essential ingredients. Module 2 dives deeper into the essential ingredients of a family-centered approach and offers practical strategies, challenges, and successes from select family-centered practitioners. The National Center on Substance Abuse and Child Welfare conducted 9 expert consultations with a diverse group of family-centered practitioners from 8 states who have successfully implemented a family-centered approach. Select practitioners across the country were identified through our close work with them over the past years. Their knowledge, experience, and expertise shared during the expert consultations helped to inform the modules. We'll also get a chance to hear from 3 of these programs, including Kentucky Start, Maida House, and Operation PAR, for our dialogue with experts this Thursday on April 8th at 11 a.m. Pacific, 2 p.m. Eastern.
Thank you, Lisa. Although we've addressed this previously, it can't be stated enough. Collaborative partnerships are the foundation of a family-centered treatment approach. No single entity or agency can meet the needs of the entire family alone, and it takes a team to do this work. The family is an essential partner and key to effectively identifying and meeting the whole family's needs and sustaining positive outcomes. Families know best what their strengths are and where they need help. True engagement of family in planning is not filling out a satisfaction survey at discharge. Authentic engagement means that family voice is incorporated and valued at every stage of planning and implementation. We've described the key ingredients in a collaborative, and we want to share with you some of the strategies that have been successful for family practitioners as they have built collaborative partnerships along the way. In the same way that service plans are designed following a comprehensive assessment of the family, conducting a community needs assessment to establish strengths and gaps in the continuum of care is an important beginning step in developing a comprehensive service array. Through lessons from many providers across the country, we also know that co-located staff is a highly effective way to build strong cross-system partnerships. Family center practitioners agree that an upfront investment of time and energy in forming strong collaborations pays off in the long term. Efforts to promote community involvement is also an important investment. The importance of partnering with family can't be overemphasized. They are the very center of a family-centered approach, and their involvement throughout the process is critical. The addition of peer support specialists in the continuum of care for families has also proven to be highly successful for engaging families early in the process and helping to address barriers. The National Center on Substance Abuse and Child Welfare has a number of great resources around the use of peers, and we'll include some of that information in the chat. Adequate and flexible funding is required for the implementation and sustainability of a family-centered approach. And yet we know that traditional funding structures typically do not support a comprehensive family-centered approach. Funding is often the barrier that providers find the most difficult to address. This slide identifies some of the funding lessons that can be applied in efforts to implement and sustain a family-centered approach. Although grant money and demonstration projects are not a long-term funding solution, they are incredibly helpful in launching a family-centered approach. Engaging state partners at the very beginning of planning is also a key strategy for success with funding efforts. By involving state partners and aligning project objectives with state and federal initiatives, partnerships are strengthened and the likelihood of sustainability is increased. Family center practitioners consistently emphasize the need to diversify funding. Funding sources are often siloed and restrictive. Accessing many different funding sources and collaborative partners is necessary to meet the complex needs of families. And marketing. Marketing is the ability to demonstrate the impact and the value of family-centered treatment to improve family and community outcomes is so important to be able to make the case for sustained funding. Some of the activities involved in being able to successfully market your program include data collection and local evaluation. Being able to tell the story behind your data is so important in this process. And planning for your marketing and for being able to tell that story and data collection all begins at day one. Building and sustaining a family-centered approach requires monitoring family success and treatment. We touched on this a little earlier. Performance monitoring is a tool for family-centered practitioners to establish high-quality services. Some of those activities include tracking outcomes. How are families doing and how do you know? Identifying gaps and strengthening services. Monitoring fidelity. Are the ingredients for a family-centered approach still in place? Engaging and building strong collaborative partners that help to inform and monitor. And using data for continuous quality improvement and to tell your story. And once again, marketing your outcomes, developing elevator speeches, identifying champions for family-centered approaches. Successfully marketing your outcomes may mean that your program becomes a policymaker's next talking points. Intensive and coordinated case management ensures that partners can address the multiple and complex needs of adults, children, and multi-generational households affected by substance use disorders, such as poverty, trauma, developmental disabilities, medical vulnerability, homelessness, or housing instabilities. Family practitioners that we've interviewed have identified fundamental principles, priorities, and goals of intensive and coordinated case management. Some of these will sound familiar. Family is defined by the person seeking services. Comprehensive family screening and assessment is essential in developing a coordinated case plan. Comprehensive services address the complex needs of families. Honoring the role of parent ensures that children's and family needs are met and foster treatment engagement. The family is an equal partner in case management planning and identification of priorities. And engaging peer support specialists and family mentors as parents encourage treatment retention and completion for the entire family. In addition, strong supportive handoffs for families is key for sustained engagement. Handing a family member an appointment card or a phone number on a piece of paper is rarely successful in referral and engagement. Establish a process, communication pathway, and practice agreements that create a warm handoff from one provider to the next. It's easy for families to become overwhelmed with the complexities and competing requirements for different service areas. Anything that we can do that enables families to best navigate their way through increases the likelihood of achieving the goal of family well-being. One of the key ingredients we've identified in a family-centered approach is high-quality substance use disorder treatment. The Substance Abuse and Mental Health Services Administration, or SAMHSA, identifies 5 elements to quality treatment: accreditation, medication, evidence-based practices, family-centered, and recovery supports. Family-centered practitioners implementing a family-centered approach expanded on those elements to include a trauma-informed and trauma-responsive approach, timely access to substance use disorder treatment services, gender-specific treatment, the inclusion of children in treatment, and providing ongoing training for treatment staff. Thoroughly assessing the family's needs and providing families access to a comprehensive array of services that meet those needs is an integral part of family-centered treatment. The services may look different, as we've talked about already. They may also look different depending on who the program serves. For example, a women's residential treatment program is going to look different than a home-based intensive services program. And where they are located also impacts this. Is this a rural or urban setting? Family-centered practitioners in the expert consultations leverage their collaborative partnerships to create a continuum of care and provide services that might not otherwise be available through their program. Examples of these critical services are shown on this slide. Staff require training and ongoing education and support to build and maintain culturally responsive services that meet the unique needs of each family member and contribute to the system of care that serves all families in the community. A multi-generational approach to providing services to families affected by substance use disorders and involved with the child welfare system is beneficial to the family in current time, and it's critical to breaking cycles that have often been in place for many years.
Now we'll spend some time reviewing what's inside the final module. Module 3 highlights the state and local level leadership and collaboration required to successfully implement and sustain the family-centered practice lessons presented in Module 2. It covers important collaborative efforts and activities such as priority setting, data collection and evaluation, tapping existing and new funding streams, and other strategies.
Transitioning traditional services to a family-centered approach requires collaboration between key state and local partners and a commitment to review and potentially redirect available resources. Collaboration among state and local agencies requires leadership, clearly specified tasks, and an agreement on what results can be achieved with a specified level of resources allocated across agencies. It's important to note that transitioning to a family-centered approach can be done incrementally rather than viewed as all or nothing. State and local policymakers have a critical role in making decisions about the scale, the number of those served compared to those in need, and the scope, the breadth and type of services delivered of a family-centered treatment approach. Finding a champion that can help direct, guide, or influence this process increases the likelihood of success. While the goal may be to change all traditional services to a family-centered approach across the system, new practices can be implemented on a smaller scale as a starting point. For example, a treatment agency can work with a local child welfare agency to begin providing family-centered treatment to a group of shared clients, or begin sharing information and coordinating services for adults and children in the family. State and local leadership efforts need to ensure the implementation and sustainability of a family-centered approach include priority setting. To move forward with implementing or expanding a family-centered approach, policymakers and collaborative partners need to agree to make it a priority. Priorities respond to the needs of clients with specific characteristics, such as foster care status, prenatal exposure, single parenting, or trauma histories. Priorities also take geography into account, recognizing the special needs of dense urban areas as well as those of rural and tribal populations. We've discussed a community needs assessment to identify gaps and strengths in the continuum of care. Community mapping is a tool that's been very helpful in this process of assessing the needs of communities. In addition to community needs assessment, a funding inventory is also an important step in determining what resources are available and could they be redirected to support a family-centered approach. In addition, reviewing available funding. Collaborative teams start with developing an inventory of all available funding sources to understand what's available and then to discuss what may be upcoming. Data collection and evaluation. Collaborative teams review data on a regular basis and use this information to make adjustments in service approaches, assess for cultural responsiveness, and support ongoing funding. The task of developing consensus among collaborative partners on how to measure progress against baseline requires data sharing and evaluation systems across agencies and systems. Performance monitoring enables partners to answer the critical questions of what works and for which clients. In the absence of shared data and evaluation systems, programs and agencies can start where they're at. Partners can begin the work towards sharing data that's available. The important thing is to start. Who pays for a family-centered approach? The exact cost of implementing a family-centered approach is difficult to quantify. It's not a one-size-fits-all approach, and we've already established the actual service array is unique to each community. We know that traditional funding structures typically don't support a comprehensive family-centered approach. Collaborative teams start with developing an inventory of all available funding sources to understand what's available and what's anticipated. And the process of a funding inventory establishes that partners agree that a family-centered approach is important and the process is worth the time and investment, identifies categories of services necessary to meet the needs of families, and identifies what services and supports are currently available and who funds them. In order for us to answer the question of who pays for a family-centered approach, or actually who will pay for a family-centered approach in the future, we need to take steps to build and sustain state and local interagency collaboration and system linkages, understand interagency collaborative funding and cost-sharing avenues, build understanding among stakeholders about existing and potential services, resources, and supports. Improve capacities of coexisting systems to streamline or realign resources to serve all families. Reduce the fragmentation, duplication, and gaps in services, supports, and resources commonly occurring across family serving entities. And to identify opportunities to improve a system's overall performance by, for example, strengthening weak connections or filling gaps in the system. I mentioned before that community mapping is a helpful tool. It's helpful not only to identify strengths and gaps in services, but also with funding. Community mapping can address both the micro and the macro approach to this work. At the macro level of community mapping, the work is to coordinate and align services, resources, and initiatives. The purpose of that work is to avoid duplication. At a time when resources are limited, the last thing any of us wants to do is build a service that's already in place in your community. Another important reason to coordinate and align services is to enable collaboratives to intentionally go after funding together, not competing for the same resources or referrals. Joint proposals are usually viewed as an advantage in competitive funding. Ultimately, we all want to make sure that families are receiving the right services at the right time. Remembering that we all share this goal is helpful as we move through this process of changing practice. Understanding the landscape of funding options can help us guide the selection of those services that may be critical first steps towards a more comprehensive family-centered program. Funding available to support family-centered approaches can be drawn from both federal treatment funding streams and a wider network of allied services from other public and private sources. There are 4 types of federal and state programs: entitlement programs, formula or block grants, discretionary grants, and direct payments. In the same way that a family-centered approach is less traditional than a client-centered approach, funding streams can also be less traditional. For example, libraries may not be seen as the most obvious place to look for funding. And yet, in a rural community that we're currently working in, the community library has become an unusual but essential partner with the community-based treatment agency. In this community, the libraries were able to offer the physical space and resources to support parent education, family time, and support services to families that could not get to the center-based services and didn't feel comfortable in that environment. Families began showing up consistently for programs and demonstrated positive outcomes toward family wellness. This non-traditional partnership proved to be highly successful for this community. Systems change is a permanent shift in doing business that relies on relationships across systems and within the community to secure needed resources to achieve better results for all children and families. A family-centered approach is just that, an approach or a framework. It's not a program. As programs move toward being family-centered, the hope is to keep moving to achieving long-term systems change. Just as people do not exist in isolation, systems also intersect in their work to serve families. Historically, systems have distinct missions and target populations, and as a result, families must interact with various agencies to get their needs met. This system of agencies, when working together, can positively affect outcomes for families through relationship building, data sharing, cross-training, and resource pooling. When siloed, these agencies miss the opportunity to provide a cohesive, evidence-based response to the multifaceted challenges families face in a community. Partners who work together across systems to identify shared goals often have the most success in sustaining some aspect of their program. Module 3 includes several strategies on negotiating shared implementation and sustainability. Providers at state and local levels are seeking resources for a family-centered approach will need to negotiate with external agencies and organizations. Sometimes state agencies can lead this process, while in other cases, local agencies will need to negotiate with each other in a process that may take time and patience. Some examples of strategies that have proven effective in negotiations for shared implementation and sustainability of a family-centered approach across agencies include clarifying how many children on the caseloads of providers may now or in the future be clients of other agencies, seeking state legislation that establishes a priority or presumptive eligibility for children whose parents are in SUD treatment, working with community-based agencies such as the Family Resource Center that play an important role in providing staffing for recovery support and advocacy. Some of these strategies may be more appropriate than others. Tailoring approaches to external agencies' needs and goals is a critical task in negotiating for the resources needed. The work of engaging community partners and establishing meaningful collaboration that seeks larger systems change will require a sense of patient urgency. Core planning, relationship building are necessary to launch a project, and then the work towards lasting change will take time. Of course, there's no time to lose for the families that we serve. There has to be a sense of urgency on all of us as well. Although relationships and partnerships take time, if you're intentional and strategic with clear objectives, seeking smaller incremental wins, you can achieve this. It's not always a straight up the hill approach. Sometimes it requires taking steps backwards to regain your balance as needed. We've covered a lot of information in a short time. So what's next? How can you begin thinking about ways to consider implementing or expanding a family-centered approach to your service array? We recommend starting with researching local, state, and federal opportunities for funding a family-centered approach, understanding the essential elements of a family-centered approach and all its benefits, and assessing the need for a family-centered approach in the community. It's important to remember that in order to understand next steps, it's important to assess what already exists. Review current funding streams, negotiate with partner agencies, incorporate performance monitoring that ensures a continuous quality improvement process. Remember that being family-centered is an evolving process and that all programs are somewhere on the continuum. The important thing is that we keep moving in the right direction with a sense of urgency for the families that need and deserve this level of care. When you're considering where along the continuum you may be in a family-centered approach framework, we suggest asking yourselves these key questions regarding existing services. How are the needs of family members included in service plans? Is there a multi-generational approach used? Are services integrated and coordinated? Are children's services distinct from parenting services? Are partnerships and collaborations in place to provide services to meet the family's needs? What evidence-based services are used, and do they support family-centered treatment? How is the family's point of view prioritized in treatment goals? How is information shared? Is there data sharing agreements that are in place? We're approaching the end of our time together for this webinar, and I've truly appreciated the opportunity to discuss a family-centered approach with all of you.